Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope it will be very convenient for the continuous study and I hope you will make use of it. Thank you very much. As you know, we have been started with a new series of general examination of children. In that, two portions like body stature and as well as the body stature etc. we have already covered. Body type and body stature we have covered. So today we will going to cover another important point that we will ask in general examination. So that is state of nutrition or nourishment. So one is body build, the first question that we will ask. So body build is nothing but it is the stature and body type, ectomorph, endomorph, mesomorph etc. Then tall stature, short stature etc. dwarfism. So that we have discussed in the last class. Second important point that we will ask in case of general examination is nourishment or nutrition. So now nutrition actually depends upon many factors that we will not discuss today. When we ask the nutrition, so usually we will see whether the child is well nourished, poorly nourished or malnourished. Now actually nutrition is a big topic in childhood practice. So therefore for the assessment of the nutrition we have got different scales. Okay, WHO scales will be there for the assessment of the undernutrition, then emaciation, stunting, then PM, different grades are there, different formulas are there. So on the basis of that, usually we will see whether it's well nourished, poorly nourished or malnourished. Well nourished means yes. What is the meaning of well nourished means? The muscle mass is the ratio between the muscle mass of the body and skeletal framework of the body. So that is actually called as well built. So when I say well built, okay, so well built of the child means the ratio between the musculature of the body and as well as the skeletal framework is almost all equal. But when I say well nourished, it depends upon the nourishment we take. It may be child may be well nourished, poorly nourished or malnourished. Well nourished means yes, okay, whatever you are taking that will be get digested, metabolized, and the product has been formed and it is utilized. Poorly nourished means the nourishment is poor. Okay, poorly nourishment means the child is taking caloric deficit food. That means that's poorly nourished in the sense basically poor nourishment means child is not able to take the sufficient amount of the food, maybe because of different reasons like poverty etc. Or if at all he is not taking the complete food. So that may lead to poor nourishment. Okay, poor nourishment. The term malnourishment means the child is taking sufficient amount of good amount of the food, but it is not properly digested and metabolized. Okay, so there's a different set of the disorders are there like malabsorption disorders. Okay, malnourishment disorders. So they are different. Malnourishment and malabsorption different disorders are there. So that is entirely different from the poor nourishment. Poor nourishment means not taking the complete food or food with the proper caloric calculation is not done. So only one type of the food has been taken. So that all leads to poor nourishment. This leads to poor nourishment. So this is one important part. Okay. Now based on this, usually we will state of nutrition. Either it is well nourished, poorly nourished or malnourished, or one more is child is normally nourished, child is overweight or child is underweight. So this is another classification. Okay, child is normal, okay, overweight. So it's overnourished. See, nourishment is of two types. One is well nourishment, poor nourishment, malnourishment, and overnourishment. Nowadays, overnourishment is the biggest problem because obesity is now the new endemic which is spreading in the global level. Okay, so now overweight is the biggest problem nowadays. So nourishment may be in excess, so that leads to overweight. So overweight child is not called as well built. Okay, so for the definition of the well built, the musculature of the body or body fat and musculatures and the ratio with the skeletal framework should be equal. Then only it is called as normal built or well built. A overweight child, although overnourished, he is not called as well built. Okay, so anyway, so normal, overweight or underweight. Now We have got two terms. One is overweight and another one is obesity. Overweight is the first stage. Obesity is the next stage. Okay. So usually we will go for body mass index to calculate this particular BMI ratio, BMI body mass index ratio. Based on that body mass index ratio, we will decide whether it is overweight or obesity. Okay, just before obesity, we will have overweight, previous condition. Now, if the BMI is more than 25, usually in children, if it's more than 25, it is called as overweight. Just before that, it is called as BMI of more than 25 is called as obesity. Just before that, it is called as overweight. Okay. Now, talking about obesity, it depends upon the excess deposition and distribution of the fat in the body. Okay, obesity is nothing but in simple terms, if you are explaining, it is excess deposition and distribution of the fat in the body. Obesity may be again mild, moderate or severe. Nowadays, for the treatment purpose, it is called as phase 1, phase 2, phase 3 like that. So either it is mild, moderate and severe. Again, it depends upon the BMI calculation and some other anthropometric calculation. Now, based on the distribution of the fat, usually obesity may be termed with the different names. Okay, one is generalized. That means the distribution of the fat is irregular and deposition of the fat is also irregular, and that is throughout the body. Then it is called as generalized obesity. Sometimes obesity may be central. Central means only in the central portion of the body, truncal portion of the body, there is deposition of the fat. Okay, so this is called central obesity. Now, central obesity, there is a hypothesis called a thrifty hypothesis proposed by Neal and Neal, who found out the reason for increasing incidence of diabetes. Okay, there the main problem is truncal obesity. Okay, so where more deposition of fat will be there in the central portion of the body. Another is buffalo type of obesity. It is also called a superior type. Superior type means here distribution of the fat or accumulation of the fat will be more in the upper part of the body, facial area, okay, neck area, facial area, chest area. The distribution will be more. Okay, that's also called as buffalo type. Another type is inferior type of obesity, where the distribution of the fat, irregular distribution of the fat will be more in the lower part, like lower limb and hip and all. Now, another is girdle type, that is in the girdle, shoulder girdle and hip girdle, and there will be more accumulation of the fat. That is called as girdle type. Trochanteric type refers to buttock, excess accumulation of the fat in the buttock area, so that is called as trochanteric type of obesity. Lipomatous type, that is a irregular type of obesity. This one is where there will be collection of the fats or lipids etc. in pockets, like lipomas like that. So this is one type of classification of the obesity. Okay, but basically obesity is of two important types. One is exogenous type and another one is endogenous type. Exogenous type is purely related to your lifestyle and as well as your diet. You are taking excess amount of the diet, okay, or maybe more fatty substances, lipid substances, triglycerides etc., trans fat etc. you are consuming more with less exercise and more sedentary habits. So that's exogenous type. So here actually what happens, weight also increases and height also increases more than the expected level. Okay, so that type of obesity is called as exogenous type, usually because of food and dietetic factors and lifestyle. Endogenous type is also called as nutritional obesity. So exogenous is also called as nutritional obesity. Okay, endogenous is also called as non-nutritional obesity. Here nutrition is not the cause. Some other cause, maybe chromosomal disorder. For example, familial hypercholesterolemia is one condition which is autosomal dominant condition, but all the family members are excessively fat or obese. Okay, so that comes under the endogenous type, or chromosomal disorders. Then comes some of the endocrinal problems. For example, hyperpituitarism, okay, hypothyroidism. So these are some conditions. Endocrinal causes may be the cause. Therefore, it is called as such obesity is included under endogenous type. Some of the other types of the obesity which is commonly seen often, that is Froelich syndrome. Froelich syndrome obesity because of the hypersecretion of the pituitary gland secretion. Okay, hypothyroid obesity very common, cretinism and myxedema. Myxedema is quite common in hypothyroidism. And myxedema is nothing but abnormal accumulation of the fat, especially in the shoulder and back area. So that also leads to obesity. That is hypothyroid obesity. Cushing syndrome is related to adrenal gland, or sometimes Cushingoid syndrome. Or Cushingoid syndrome is related to pituitary gland, whereas Cushing syndrome is related to excess production of the adrenal hormones. It may be sometimes drug induced also, Cushing-like syndrome, because of excess intake of the steroids, etc. Another one is adrenogenital syndrome, that also leads to obesity. Polycystic ovary syndrome, that is also one of the cause for the obesity. Hypogonadism, that may also lead to obesity. Menopausal obesity, sometime during the time of the menopause also there will be obesity. So these are some of the other obesity types. Some of the rare types of obesity, if you want to see, Durkheim's disease. Durkheim's disease is nothing but same, that lipomas, irregular formation of this abnormal formation of the lipomatous tissues, lipomas, etc. Another one is physiological obesity. Sometimes obesity will be there in the puberty time. That is quite physiological. Later on also it will be corrected. Water salt obesity, that is because of excess intake of the salt and as water, because of the water retention. There may be obesity, okay, fluid retention. Then hyperinsulinism obesity is also common. Some of the syndromes like Lawrence-Moon-Badel syndrome, then Hand-Schleiner and Christian syndrome. So these are some of the rare syndromes which may lead to obesity. Prader-Willi syndrome is one more syndrome. Especially in children, Prader-Willi syndrome is one syndrome which is also associated with the obesity. Prader-Willi syndrome is one more syndrome. These two syndromes are the causes of obesity, syndromatic causes of obesity in children. Now talking about underweight. Underweight means we use the different words for underweight. Leanness, thinness, first stage. Then comes emaciation and wasting. Then cachexia. Cachexia is extreme weakness. Now in terms of Ayurveda we use the different words like kshaya is there, then shosha is there, kshaya is there, mamsa kshaya is there, mamsa shosha is there. So they actually indicate the different grades of this underweight. Underweight, stunting, emaciation. So that will be taken in pediatrics care with great interest, because we have got different formulas for their calculation. PM, then protein energy malnutrition comes under this. Then severe malnutrition, okay, moderate malnutrition and mild level of malnutrition. We have got different formulas and calculation method for that. So that we will not discuss here. In specific pediatric history we will discuss it. So this is just a introduction. So this is all about nourishment. Nourishment depends upon, nutrition depends upon many factors: physiological factors, social factors, familial factors, cultural factors, okay, personal factors, individual palatability, okay, some of the allergic disorders. It depends upon many factors. That portion we will not discuss. Only as far as the examination is concerned, general examination, yes, nutrition you have to check, and what are the pitfalls of nutrition that we have discussed. Thank you very much. In the next class we will come with another important factor related to general examination, that is posture. Thank you very much.